Good morning and welcome to All in Chicago 2020. This event is called Where Are the Women in Healthcare Leadership? Why Gender Bias Matters and How to Fix It. My name is Laura Cerisi Starr and I am the Director of Development and Communications at CommunityHealth. CommunityHealth is the largest volunteer-based free health center in the United States. We provide primary and specialty care, prescription medications, mental health and dental services, health education, and lab testing, including COVID testing, on the west side of Chicago. Our patients have no health insurance, and we provide all of our services to them at no charge. We do this with the support of over 1,000 volunteers, partnerships with dozens of institutions, and donations from generous people like you. Thank you for being here and for supporting CommunityHealth. I would especially like to recognize our many sponsors who are supporting this year's All In series, including Baxter, Blue Cross and Blue Shield of Illinois, AbbVie, Lundbeck, the Joseph and Bessie Feinberg Foundation, West Monroe Partners, and many others. I encourage you to visit our website, allin-chicago.org, to see the complete list of sponsors, read the bios for our incredible speakers, and check out the rest of the month's events. Finally, I want to recognize this year's All In Executive Leadership Council. We have the privilege of having 4 outstanding leaders serving on the council this year. Their great insights and support have been instrumental in bringing this year's series to life. Thank you to Joe Flanagan, Kimberly Hobson, Stacy Lindau, and John Maples for your contributions this year. Unfortunately, Kimberly was scheduled to join us on today's panel, but she was called away unexpectedly at the last minute. This just speaks to the many competing demands on our leaders and is totally relevant to today's conversation. The goal of the All in Chicago series is to bring together leaders from many different industries and segments of our population to talk about how we can work together to ensure every resident has access to the right care in the right place at the right time. While we are doing things a little differently with the virtual broadcast this year, CommunityHealth has been hosting all-in events discussing access to healthcare in Chicago since 2015. This year, as we are all living with a global pandemic, the conversation around access feels more relevant than ever. COVID-19 has brought on many new challenges to leading our healthcare organizations and our home lives over the last 6 months. Our panel today has been meeting and overcoming these challenges in the impressive ways they have done their entire careers. It is my pleasure now to introduce our moderator for today's conversation, Meghan Phillipp. Meghan is the Executive Director of HC3, the Healthcare Council of Chicago, the organization who is co-presenting with us today. HC3 is an action-oriented collaborative that brings together leaders from across the healthcare system to address Chicago's most important health-related issues. Meghan is also a good friend of CommunityHealth and actually led our All in Chicago programming in 2019. We have asked her to set the stage for today's conversation with a bit of data on women in healthcare leadership. So with no further ado, I will hand things over to Meghan to frame things up and then to introduce our panelists. Thanks for being here, Meghan.
Thanks, Laura. It's an absolute pleasure for me to be here virtually with everyone for this important discussion. I, as Laura mentioned, have been part of the All In series before since 2016, and I've had the privilege of seeing firsthand some of Chicago's incredible leaders in action as we strive for better care and better outcomes for everyone in our local communities. As we endeavor to fulfill the All In mission of access, it is so important to recognize and empower strong leadership to guide us. So, where are all the women in healthcare leadership? In 1920, the 19th Amendment was passed and women were given the right to vote. 100 years later, we're still seeking gender equality. According to some recent polls, 69% of adults in the United States think that women are not treated equally at work. 48% say it will take 10 to 30 years or more to achieve gender equality in the workplace, and 8% think it is never going to happen. I, for one, hope that that 8% is not the truth and that we get to the bottom of it today. Next slide. Women make up a majority of the healthcare workforce, 66% of all entry-level positions, and 59% of all managerial positions are held by women. However, as you move up the ranks, there are less and less female representation. Next slide. In 2018, there were only 5 women at the helm of 50 of the largest non-for-profit healthcare systems in the US. On average, these women made $3.3 million annually compared to their male counterparts at $4.9 million, meaning these women were earning 67 cents for every dollar that their male counterparts were earning as CEOs of these organizations. Seeing so few women CEOs is a striking fact because women make up 3/4 of the healthcare workforce. Next slide. There is also a huge lack of representation for women of color in the healthcare industry. In a recent report released from McKinsey in August, it outlines how women of color account for just 20% of entry-level positions, and at the VP level, it continues to decrease from 7%. Next slide. Ellen Zane was named the first CEO of a health system in 2004 at Tufts Medical Center in Boston. When she retired from her post, she said, "I found as a woman, I had to do things that were uniquely different in order to be differentiated." Women have to think, look, and act differently to overcome biases and societal pressures. 42% of women in the workforce say they have experienced some form of gender discrimination, and 22% say that they have been sexually harassed. On top of the pressures that women have to outperform their male counterparts, some men are threatened by this progress. Almost 3 in 10 men believe that progress towards gender equity comes at their own expense. And to add fuel to the fire, women are also facing tons of pressure to be involved parents and physically attractive. As we hear from our panel discussion today, I will ask our panelists to turn their cameras on so you can see who is speaking during the conversation. One quick housekeeping item, this conversation is happening live, so please be sure to submit your questions for our panelists. We will do our best to answer as many as possible during the next hour or so, but just submit your questions to the Q&A button at the bottom of your screen. I am now pleased to introduce some inspirational women in our local healthcare community. Dr. Tiosha Bailey is the executive director at Susan G. Komen Chicago, where she drives strategy to ensure measurable impact upon breast cancer outcomes. Dr. Bailey previously served as deputy commissioner of the Health Promotion Bureau within the Chicago Department of Public Health, where she steered the public health agenda for key mayoral initiatives in the areas of breast cancer, behavioral health, and violence prevention. Iliana Mora is the Chief Operating Officer for Cook County Health's Ambulatory Division, which provides primary and specialty outpatient care in community, school, and regional settings. Prior to Cook County, Iliana was a staunch advocate for the low-income communities of color served at Erie Family Health Center. She led Erie in its location and service expansion, more than doubling the organization size. Dr. Anne Marie Murphy is the executive director of Equal Hope, an organization that works to eliminate health disparities for Illinois women through prevention, screening, and treatment of breast, cervical, and other cancers. Under her leadership, Illinois became the first in the nation to roll out a statewide mammography quality surveillance program embedded in Medicaid and run by Equal Hope. Dr. Murphy previously served as Illinois Governor's Director of State Healthcare Initiatives and the Illinois Medical Director. Welcome to these incredibly accomplished panelists. Before we dive in, one more time, if you have a question, don't hesitate to ask. We will use the Q&A function at the bottom and we'll get to as many as we can throughout the program. So I'm just gonna open up the floor to everyone and start with a question to kind of really set the stage of where you are now. So what was your path to the role that you have now, and how does the mission influence your current leadership? We'll start with you, Dr. Tiosha Bailey.
So I would say that for me, I've had a very steep leadership trajectory. And I think a lot of my success has been made possible because of some mentorship and sponsorship and people who saw the leadership qualities in me very early on before that I saw them in myself. And I had been given the opportunity to really spread my wings at Erie Family Health Center, you know, growing and moving up the ranks. And so being surrounded by people who believed in me and putting me in positions to really grow has helped me exponentially. I would say for me here at Komen Chicago, the mission is why I'm here. I am passionate about eliminating mortality disparities. Like many others, I've experienced the loss of loved ones to cancer, but also I've experienced the joys of survivorship, and I want that for more women. And I understand that there is a real gap and a need here in Chicago, and that is what fuels me and keeps me going every single day. And I won't stop until the gap is closed. So I'm very happy to be here with you all this morning and having this very important discussion.
Yeah, and we don't want you to stop. Anne Marie, what about you?
Remember to unmute, of course.
Yep,
Sorry.
You're good now.
Yes, so I have had a very indirect, I would say, curving pathway to where I am now. I often joke, and I do joke, that I never took a job that I had any qualifications for. Hopefully that's not entirely true, but I moved to the US, so I'm an immigrant, to get my PhD at Johns Hopkins, and then decided to go work on the Hill for Senator Durbin. And I moved from there, from sort of politics on the Hill, to run the state's Medicaid program. And from there, I moved to run a not-for-profit that works on health disparities. But I've always been interested and committed to disparities elimination. As an immigrant coming from elsewhere, it never ceases to amaze me that the wealthiest country in the world does not really have a healthcare system. We have a patchwork of payment methodologies for different groups of people, and so many people fall through the cracks. Every day it amazes me how, in many senses, messed up the healthcare system in the US is, but it's people here at places like CommunityHealth who have tuned in today, other advocates that really do their best with their commitment to make the best of what is not a system for so many who are disadvantaged by the way that we do healthcare here. That's what really gets me up in the morning, is trying to make sure that people get adequate healthcare and get what they need to stay alive.
Great. We'll come back to you. Iliana, how did you get to where you are and what is inspiring you now? You gotta unmute.
All right, sorry.
It's okay.
I would agree with everything that Tiosha and Anne Marie said. I would just to add to what they said, I'd say, I think all of us women, a lot of hard work, right? And not just like getting by, but like going above and beyond, putting in a lot of hours and producing really, really excellent work. That perhaps if we didn't look the way we were or had the opportunity to give birth, if we're moms, we wouldn't necessarily have to do all of those things. And I think that is ultimately all the things they said, but also just a lot of grit and a lot of hours and a lot of investment. Why do I do what I do? I think, you know, like everyone, the mission of what we do gets us up every morning. There is an enormous need, a problem that hasn't been solved, like Anne Marie said. We work in a system and in a country where healthcare inequity exists every day, and we see it more with COVID. And so that is my inspiration every day. When I get up and when I'm really tired, you know, especially during COVID, It's the communities that we serve, the communities who need us and who may not otherwise have access to services if it weren't like organizations that we work for.
Great. Anne-Marie, I'm going to take it back to you. I love what you said about, not having all the qualifications for a job. I mean, I didn't put it in the slides, but there was a statistic that LinkedIn put out that women were less likely to apply for jobs that they thought they weren't qualified for. So I'm curious about your experiences having worked in government and now in a community-based organization. How do you get it done? How do you convince people you are qualified and that you are capable of rising to the occasion?
Yeah, I remember way back when I was in grad school, I shared a house with a woman who was going to law school. And she had those lovely tapes that teach you how to pass the bar. And the beginning of that tape, there was a little intro piece that said, remember all the people that you know that qualified as a lawyer. How hard can it really be? And of course, it was very tongue-in-cheek in regards to the fact that there is a diversity of, shall we say, competencies in the professional world. And there are people that pass the bar that one is surprised. But that has always stuck with me in regards to the notion that persistence and a little level of relentlessness often goes a long way. And when I mentor other younger women, I always suggest a variety of things. One is networking. It is key to network and to get to know people. The system of employment is highly based on relationships. And secondly, I suggest attempting to put yourself out there to run projects in a manner where you are wholly accountable. Not with the, oh, she didn't do this and he didn't do that and all the other excuses. If you can put yourself in an ability to get the job done, no nonsense, and be accountable for the success of the project, I think that goes a long way to advancing you being given more responsibility and people believing that you can, in fact, get work done.
Tiosha, you've been nodding your head, and I'm curious, my question that I had for you next was, what does leadership look like to you? And so I find that management is different than leadership. So yeah. Taking on a lot of the projects that you've taken on prior to your role now, I mean, what does that look like leading those efforts?
Yeah, well, I just definitely, I want to applaud Anne-Marie and being able to impart that knowledge upon her mentees. I think it's important. As women, a lot of times we shrink ourselves and come at projects and things with deficit thinking and not putting ourselves in a place where we are offered the stretch. And that having someone give you that knowledge and having people run with it is important. And so it's definitely something I want to tuck in my back pocket when I talk to my mentees. But when it comes to leadership, I think a lot of people think of it in the broadest sense of a button, a seat, a role, a title, where someone sits within an organization. And personally, I believe leadership is about the attributes and the talents and what you bring to the workplace, how you show up, right? How you are a role model to other people and truly exhibiting the qualities that you want to see in other people versus management. Management is the day-to-day, right? It's the tactical elements of the job and what you have to do to get things done. But leadership is about you and who you are. And in order to be successful as a woman in leadership, it's important to really know who you are and not be moved. There'll be a lot of challenges and you'll be faced with, tough decisions, but knowing your values and honoring those values will be key to your success and being able to get things done and drive change in a meaningful way.
Yeah. Iliana, you have spent your career leading organizations that serve populations of underserved women, particularly women of color. How can leadership impact the health of those women?
Probably the most important is the fact that we're actually in the boardroom making the decisions that will impact all of the women. Diversity in the boardroom is critical. I've been in boardrooms and part of groups where I was the only person of color, and also in executive boardrooms where I am among other individuals of color. And it makes a difference. You know, it really makes a difference in terms of how your decision will come out. And there are a lot of, I mean, this is no surprise, right? I mean, there's just so much, even for those of us who think we know certain communities because we've worked in it for so long, having diverse, you know, where we grew up, even geographically in the city, diversity in terms of gender, it makes a huge difference in the strategy, in the tactics, in how you decide to communicate your decisions, your sensitivity around how you communicate to your own staff and the communities that these changes or decisions will impact. And so I think the you know, greatest impact we can have on women in healthcare, receiving healthcare, being the recipients of healthcare, is to have more women in the boardrooms.
And then this kind of piggybacks on that comment that you want to see more women in the boardroom. Someone in the chat has asked, what advice would you give to undocumented or DACA women in healthcare field that want to advance their careers and move up the ladder? And I think it just goes for anyone that has any sort of bias against them. Like, how do they get to that boardroom? And what advice do you, or I welcome others from the panel to also weigh in on this.
Sure. You know, I would advise them as nothing less than we would advise anyone else. Of course, there are technicalities, I understand, that are different for them. And so I do want to acknowledge that. But, you know, if they've got the initiative, they've got the talent, they're relentless, like Anne Marie said, they have the perseverance. That's where we all, you know, have to come together and support each other and help each other get to those jobs, to the boardrooms, and make sure that we lift each other up and ensure that we help each other get to where we need to have greater impact.
Tiosha and Anne Marie, both of you are currently working on addressing inequities around breast cancer in African American women. Where are we, and where were we? So for people historically to understand, and where are we going in combating that issue?
Well, Equal Hope has done a lot of epidemiology, as has the Sinai Urban Health Institute, in regards to this. And in fact, an interesting paper that came out last year from Otis Brawley and Blaise Polite, who's at University of Chicago, pointed out that, you know, Chicago had no disparity in breast cancer in 1980, but by the time we got to like 2007, there was a, depending on which ways you calculated it, a 62 to a 68% death gap, which means that Black women were dying at a rate 62 to 68% higher than white women, even though they at the time got breast cancer less often. So where the death rate for white women had halved over the 20 years leading up to that time, it hadn't actually come down even 1% for Black women. We established a project in 2007, 2008, which originally was called the Metropolitan Chicago Breast Cancer Task Force, a name that really rolls off the tongue, not. So we have rebranded to Equal Hope. And we published a paper in 2017 that I was thrilled about, that work was certainly funded by Susan G. Komen and others, showed that Chicago had gone from being one of the worst to being number one in reducing breast cancer deaths for African American women, which we're thrilled about. And the following year, we published a paper that showed that the residual disparity, because it's now down to about a 39% gap, is highly concentrated amongst younger women. And that is a little bit of a conundrum as to what we're going to do to address that, because women, you know, under 40 are not generally advised to be getting screened. And there's the whole question as to why is that? Why is it that African American women on average get breast cancer earlier, and why they get more aggressive tumors at a higher rate? I think there's some good research that suggests that relates to stress, environmental stress, and sort of conditions of life. And so a lot of the things that we need to do to make progress here involve not just at the healthcare, but the social determinants of health, going further upstream. But we're making progress, which is great. There's a whole variety of other diseases that have actually been going in the opposite direction. So we're thrilled to partner with CommunityHealth in rolling out a new medical homes project to help people who don't have a regular doctor get one, because we think that, you know, you need more than breast care. You know, we need a holistic, you know, there's your colon, there's, you know, your cervix, there's the whole 9 yards, and you need comprehensive health care. Every person deserves access to high quality, comprehensive health care. So thank you, CommunityHealth, for being there.
And I agree with everything that Anne-Marie shared. The other thing I would want to just highlight that I think from a public health perspective, a lot of our efforts have been largely in focusing on the individual. I think it's time that there's a shift to be harder on systems, right? That also drive the disparities that we see, and asking systems to really look within and really see where people are falling through the cracks. And how they can make some modifications to really bring people in, and that once they do engage with the system, that they are receiving high quality care. I think that's the other piece that, you know, Equal Hope really helped to highlight as part of their paper, is that all healthcare is not created equally. And that's something that we really have to call attention to and address as a city. And so I think we're on the right track. We have a ways to go. We're leaders, but we know that we have to look more internally and looking at systems specifically.
That makes a lot of sense. And I think a lot of this was happening pre-COVID, that we've started to think about what this access pipeline looks like. But what do you think some of the challenges are now? I unfortunately don't have numbers off the top of my head, but I do know there was a higher percentage of women that were less likely to go for regular visits than men during this time. Mm-hmm. So what do you think are some of are you seeing some gaps for patients that you all serve? What are some of the challenges because of COVID, and what do we think the repercussions of some of that will be?
So with COVID, well, first of all preventive health services closed down for several months. So you couldn't even go for a mammogram, and couldn't go for a cervical cancer screen, even if you'd wanted to. So I know that the National Cancer Institute director is quite worried about the fact that cancer doesn't pause during a pandemic, and that putting off screens, people are going to get later stage cancer, and that's going to have all the sequelae that it normally has. Now that facilities are opening back up and are engaged in procedures to help do that safely, there's a whole issue of encouraging people to go for screens and to feel comfortable that adequate precautions are being taken. I think all of us would say that, you know, plenty of screens like a PAP, they're not the most comfortable thing around. So if you can think of an excuse as to why you didn't want to go for it, you know, or whether it's a dental cleaning, we're all a little inclined to move it to a little later. But cancer is not moving itself to a little later. So I think we all are part of that solution ourselves. We need to encourage everybody, but in particular those that this is a hard time for women. Women are losing their jobs disproportionately. McKinsey came out with a recent report that said globally, women's job loss is 1.8 times that of men's. And only 25% of that they accounted to the types of jobs that women have. There's a lot that relate to their unpaid care work. Here in the US, McKinsey calculated that women are on average doing an hour to 2 hours more a day in unpaid care over and above what they were already doing. So I know I'm not the only one. I'm sure we're all here feeling a little stressed. And for those of us that feel a little stressed, but we have, economic support, one can only imagine how much worse it is for those that have less resources, who's are more likely to have family members with COVID, those that have died, those that have become extremely sick and don't have resources to support themselves. It is a really challenging time.
Yeah, I agree.
I think
I wanted to just say the other challenge that Anne-Marie brought up to mind is that we're in this for the foreseeable future. It is actively a pandemic. All these challenges are bubbling up, and we know we need to address them, but it's going to be a while before the state of things really shift. And so how do we really encourage those hard to reach populations that had challenges before COVID? And now things have become insurmountable. And what does that look like? How can people women specifically in leadership roles help to alleviate some of the barriers that exist within our own institutions to get those folks in the door? I think is what we all should be focusing on.
Right, like
and then I think
just
go for it.
a quick note was that one thing that Equal Hope did once the pandemic started was that we trained all our navigators on a social needs assessment tool, and we now use NowPow, which I saw was a sponsor, and another tool, Aunt Bertha's, to screen people for emergency needs. And so our navigators are helping people get food assistance and utility assistance and, rent assistance. Everything that we can think of, we're trying to do to give people more support during this extremely difficult time.
And then going back to some of Anne-Marie's points about the McKinsey study, which is really interesting. It's a lot of what has influenced my lens on today's discussion. I'll go back to Iliana. I mean, what each of you, as we were preparing to get on the call, we're talking about what's going on at home. I mean, you all are literally juggling life, children, your work, and still prioritizing these vulnerable populations that need your help. So what is your take on the sort of workforce flow for women and sort of the pressure and how to balance that right now? Is there any letting up during this time?
Yeah, probably no. I mean, there really isn't. I'm a realist and an optimist at the same time, but not really. I mean, even for those of us who don't have children, like what Anne-Marie said, I mean, as women, we're challenged, we're the ones most getting hit by the job losses and so forth. In terms of, so what does it take? I think it takes, and this is just my personal experience, that I'm not perfect and an acceptance of that. It's taken me years to accept that. I think motherhood has helped me be better at realizing that. And then like prioritizing, okay, where can I fail and still be okay? Although that's not how I really think, I don't think that negatively, but I think that's ultimately what happens in my head, because I got to be honest, I can't do it all. I just can't. I can't be the perfect leader, although I would say that takes a huge part of me is the leadership role, because we're responsible for the decisions that we make have an impact on thousands of, not just our staff, thousands of staff and thousands of community members and women and families that, leadership in the role that I'm in definitely hits it to the top. And where I tend to fall short is exactly where Anne-Marie said. I mean, how many times have I rescheduled a medical appointment? The last time I went to the dentist, I sat down and he said, "It's been a long time since you've been here." And I said, "I know, it's got to be like, 6 months?" So he looks it up, and he's like, it was 24 months ago. And I'm like, oh God. And I have been rescheduling that for the last 24 minus 6, because you're supposed to go every 6 months. Now the dentist isn't something like a mammogram, right? Although I have rescheduled those too. So it's hard, and I'm not giving any really good advice here. Maybe Anne-Marie and Tiosha can help, but we tend to be the last on the poll, right? First, my job is really up there. My kids are. My husband's like down here, and he pretty much knows that. And then I'm like in the basement. So that's not healthy. I think part of the solution is really beyond me personally as an individual, and part of the solution is really about, we talked about this a little bit as we were discussing this call, is the workplace was never designed for us women. We're certainly exceptional leaders, and the workplace needs more of us for more, we can do a whole panel discussion on that, but it wasn't designed for us. And every day we try to fit in as much as we can into what we're trying to work in and be successful in, but we can't be. And so I think that's another, we need to come together and or in our leadership roles. I am very attentive to, when I make policy decisions for my employees, that I am very attentive to that. And that I am not, it's very easy to follow the way that business has run as usual and carry on those policies. And who really wants to create new policies anyway, right? It's just so much more work to redesign the workplace. I think as a leader in my own institution, I can do that from that perspective. But I think even on a grander scheme, there's opportunities for us to come together and say, no, this isn't okay. I think some of it is also, well, our competitor's doing this, so then we should do this. And that's the reason sometimes organizations make those decisions. But if us women who are in those meetings just said, you know what, let's all agree that we're gonna, it's simple, right? Paid leave for women, or, whatever it is. And then we could more globally have an impact. Those are some of the ways to go about it.
Yeah, I would say that in that McKinsey study that is only recently out, they talk about how they have 3 scenarios. If we do nothing today to address globally women's inequality, that it will cost us in lost productivity over $1 trillion by 2030. If we wait until later to do something so we wait till 2024 to aggressively attack policies related to gender inequity, we would, make, I think it was an extra 5 trillion in global productivity. But that if we addressed things today, starting in 2020, we actually pushed forward with those kinds of family-friendly, women-friendly policies and legislation, we could actually increase global productivity by 13 trillion, because driving women out of the workforce or cutting back their hours is not good for the overall good of humanity, contrary to some people's viewpoints. But that certainly if one even looks at it in a dollars and cents, it costs us a lot when we marginalize a large amount of the population.
I have a question from the chat. And anybody can answer this, and it kind of piggybacks on Anne-Marie's comments of just how do we build on this? How do we look to coalitions and collaborations in building women in healthcare leadership? So if we did nothing, then we know that we would lose a bunch of money in the long run. But what can we do to start to be proactive? What can we do today? And what folks here, I think, are hungry for is what can they do to start to advance these opportunities?
So I think that doing something now is the prudent thing to do, but also recognizing that we all are stretched very, very thin and can't take on this superwoman complex of I, need to save this, the country and the state of things, that we have to really rely on our counterparts, other women in leadership capacities across other organizations to be able to come up with a plan collectively. I know that there are some coalitions that exist. I can honestly say from my own experience, I have not actively sought out any of these coalitions, but I think that's part of the answer, is that we really have to band together and to say, this is the state of things. These are the challenges that are ahead of us, and work together and bringing all that talent to the table to say, these are the steps that need to be taken for the greater good.
Well, Tiosha, and you also, oh, sorry.
I was just going to say that I think there's also a sort of an inside out. There are some fabulous not-for-profits here in Chicago that are doing a lot of organizing at the local level. And I think that Chicago can demonstrate through progressive ordinances that it is possible to have workplace rules that benefit families. We have made some progress under Mayor Lightfoot with the passing of the ordinance to ensure that people get their schedule 2 weeks out. That I know from our experience navigating women is incredibly important. If you want to schedule a mammogram or other healthcare services, you need to know what your work schedule is. There's other ordinances have passed in regards to sick time. Obviously, as a country, we need to do a lot better in regards to, and that involves us all doing our part, and irrespective of what anyone says, voting early, potentially getting your ballot to the box so that we can all together push for a collective agenda that is one that is good for women and good for families, and therefore good for everyone.
Yeah, 100%. And one of the chat questions is, you take a very holistic approach to taking care of the whole human and looking at these matters from the family planning perspective. But do you think having women in critical leadership roles helps advance this philosophy of recognizing and engaging the whole person?
I do. Obviously women, you'll hope that women, when they get to leadership roles, will remember all the struggle they've had and remember all the struggle that their sisters are having, and that won't try to just be the same as the sort of status quo. And I think that goes to what Iliana mentioned about how she feels responsible for enacting policies that are sensitive to those that work for her and for the institution. If women remember and advocate for other women, I think that is a great way forward. And it's good for all of us to see women stepping up and being in positions of power and leadership. Yeah, I do think that does change the conversation. Even if you just walk into a boardroom and there's a greater balance in gender, the conversation is usually a little different than if you go in and you're the only one there. I think hopefully when you're the only one, the conversation doesn't just stop once you walked in the door. But I think it's important for all of us, especially our girls, to see women in positions of trust and power.
I would add that even though we're women and we're, sensitive to that, a couple things. We're not perfect, and we're working in institutions that were, designed a certain way. And it can be easy, even for those of us who are conscious of it, to look at the dollars and cents and potentially not even realize that we're going down a route that, you know, is not what we really intended to. And so I think it's important as decision makers that we're reflective. You know, give us just a minute of reflection when we're making decisions like that. I think the other thing I think about is it's not easy to be the woman in the boardroom, because, you know, how do people see us? You know, they raise the eyebrow. They're like, you know, she's the woman, of course she's going to bring this up. Or, you know, she's got the children, of course she's going to bring up. They don't say that, but it's complicated. You know, like even now in my institution, you know, we have pretty much every school age child having some form of remote, you know, working. Yet I'm in a setting that delivers, you know, in-person care. However, we are also delivering an enormous amount of telehealth care. So in my mind, I'm like, we can make this happen for women. You know, we will find that, you know, just like the providers doing telehealth, I can find a solution for the front desk. I can find a solution for the MA and for the nurse. But I have a whole system pushing me and saying, well, how are you going to prove that they're working? Or, you know, I'm making some of this up. How are you going to do this? How are you going to do that? How are you going to do that? That's like a lot more work for me to do, right? Like, it's so much easier for me to be like, fine, let's just tell everybody they can't work at home. I even have my, you know, some of my direct reports that are women. And this is not a knock on them. This is just the reality of, like, is that the, like, do I have that energy? To the earlier question you said, like, how much stamina do you need? A lot, right? And it's totally fair for a woman, like one of my employees, my direct reports, to say, God, I don't know if I have that in me to fight it. I get it. But so then that's where my role is like, no, we got to keep at it, guys. We can make this happen. We can do this. But it's not easy. And so I think our ability to stay to our convictions and, you know, again, support of each other, you know, will be also the linchpin to making some of this change happen.
Absolutely. And there's two questions that I'm going to try together around, you know, what does mentorship look like? When did you have one? You know, Tiosha, I know that you said there were several people that really kind of made you realize that you were capable. And what did that look like? Or how did you seek it out if it wasn't presenting itself? People are just kind of wondering, how do you go down that path to move forward with that?
Yeah, I honestly wish that I knew more about mentorship and the value earlier on in my career. I really didn't understand what a mentor could really do for me. I think that people see mentors as people that are across the room or above them, and not even thinking about people that are their peers that could offer some encouragement or some mentorship. So I really want to encourage people to think within their current circles of who could help them and provide mentorship. The other part of it is, I think it's important for when you're going to actively seek out a mentor, I think it's challenging to come at it and say, hey, I want to pick your brain, I want you to mentor me, and all of that. That's overwhelming for any person. I think it's important, though, we be critical of ourselves, of the value add that we feel like we can bring to that relationship. Mentorship is not a one directional kind of situation. It's two people that are really supporting each other. And I think that that's what a lot of women, especially women in leadership that are busy and don't have a lot of time, they want to work with, support other women for sure, but definitely women who come to the table seeking to add value as well and not just take. And that, I think, is important. If people do not have mentors, I say you got to get one. You need mentorship. I think it's important to have that sounding board. Working in leadership is hard. Iliana has talked about it. Anne Marie has talked about it. Being in those boardrooms are tough. Sticking to your convictions are tough. but working with other people who have lived experience and can tell you how they may have navigated a similar situation can definitely aid you in the future. And I know it has been very critical to my success and learning from other people and how they've navigated those really sticky things. So I'm not walking alone, because being in these seats can be very lonely. And so that support network is critical.
Yeah, I would say that there are also some leadership programs here in Chicago that I haven't necessarily availed of them, but I know people that have, and they seem to have been just fabulous. I know the Chicago Community Trust has one. I know that the Chicago Foundation for Women has one for women of color. You know, there's a variety out there, and from what I can see, people have really gained a lot from them. I know that I Will is another, Illinois Women in Leadership. So I do think that there are a variety of resources that are, I did avail of, I did an American Association for the Advancement of Science fellowship program on Capitol Hill, which was a great way to transition jobs from an on the bench scientist to working in politics and policy. So I think for younger women, I would suggest like looking at those. I must say that one of my mentors, who I look back so fondly on, is Ruth Rothstein. She was head of county and did that like really in retirement, because she never truly retired. And she was fearless. When I worked in Senator Durbin's office, I remember him telling me that there were a few things that he never wanted me to do. And one of them was to put him in the position of ever saying no to Ruth Rothstein. And I understand why. And there are moments when I think I'm in a tense situation and I go, what would Ruth do? She would not be scared of this. She would not cry. She would not back down. She would go straight forward. And both she and Sister Sheila have both, I think, been inspirations to me in regards to fearlessness.
So we have just a few minutes left. So I'm going to pose a question to everyone, and then we can just kind of go around. What impact do you personally hope to have on the individuals you serve, or what sort of greater impact do you want to make with your career? So I'll start with you, Tiosha, because you're next on my screen.
I think for me, the biggest thing is I want to empower other women to take charge of their health. I want to be seen as a role model in this space. We tend to see ourselves as caretakers of everyone else and not ourselves. And I really want to make sure that women have the tools and the resources that they need so that they themselves can create wellness in their lives. I mentioned very early on at the beginning of this panel is that I'm wholly committed to addressing the mortality disparities between Black and white women. And that is my charge and what brings me to work every day. And that is a huge structural change that I hope to bring about within Chicago.
Anne Marie.
Unmuting. My main passion is disparities. I did a crazy thing within the last month or two. I decided, because I didn't have enough to do, I would go back to school. So I'm now enrolled at UIC in the MPH class. And that is really because I want to do better at what I do. I wanted to learn more. So I think somebody asked questions about websites and things you read. I don't read anything. I hardly watch TV at all, except for since COVID. But I am passionate about reducing health disparities. And I truly believe that everyone deserves an equal chance at a long and healthy life, and that it can be done, and that we should do everything in our power to do it, because it's the right thing to do.
And Iliana?
It was very similar to what Tiosha said, really. Empowerment in every form, and encouragement and inspiring and motivating all women whether it's in a position of seeking care, like Tiosha said, or it's in a position of, completing a degree, or, just seeking to reach the goals that you want, and that everything is possible. And, we all need help. Nobody can do it on their own, but a motivation to get there.
Wonderful. I'm going to wrap it up, but I'm just going to make one comment that for me, this has been a super inspirational discussion. I have been now the executive director of HD3 for a little over a year, but I attribute my success in getting this job because of Laura Starr at CommunityHealth. I worked at CommunityHealth before I took this role. I, like Anne-Marie, probably felt underqualified, but I felt like I learned so much from my previous role, and I was lifted by so many beautiful women at CommunityHealth, and that's why I stay involved with this organization. And I'm so proud to have been part of this discussion because it's a tribute to everything that I have personally experienced in my career so far. So thank you all so much. I feel like we could talk for hours, but we all are running the world and have to get back to it. So I'm going to kick it back over to Laura.
Thank you so much, Meghan, and thank you for the little shout out there. You certainly made me blush over here, and I just wanted to reiterate your thanks to all of our panelists as well. This was a really fabulous conversation. I loved hearing everything all of you had to say, and the time just flew by for me. So I imagine that it did for our attendees as well. So thank you all so much for being here for this conversation. As I mentioned earlier, today's program was brought to you by CommunityHealth. So all of the donations that you made before you came in here today and any that you make now will support CommunityHealth's mission to serve those without essential health care. So please consider making a contribution now to support CommunityHealth. Instructions are on your screen right now, and I will ask Nina to drop a link in the chat box as well for you. But on behalf of the staff, the board of directors, and the volunteers at CommunityHealth, I want to thank all of you for being part of our All in Chicago event series. I hope that you are all leaving today with ideas for how we can work together to make the vision of access to care for all Chicagoans a reality and to help move forward our women in leadership. We have 5 more events coming up throughout the rest of this month, and they are all free to attend. I encourage you to check out our website, allin-chicago.org, to learn more about the great events coming up and register to be all in. We all have a critical role to play in this effort, so thank you for being part of today's event.